speaker is someone who has so much knowledge on health and wellness. I mean, when we were talking to her about giving a presentation at this event, we realized she could just about speak on anything, right? Being a naturopath, studying so many years, so much research. When we ask her about anything regarding the human physiology, neurology, biology, she just has like wealth of information, and she can just talk about any topic, and it's just incredible. So we were trying to come up with like what's something that people need to understand. And for those of you who know the work that I'm involved in, is I'm very interested in sort of neuroscience and how the brain interacts. And so I talk a lot about neurochemicals. You know, dopamine, serotonin, norepinephrine. These things have very powerful effects on our behavior. And when I was talking to Ray, she's like, yeah, those are important, but they're not the whole picture. The hormones interacting with the neurochemicals are almost preeminent in many cases. And I was like, oh, really? Because a lot of, if you look at TV or even in the media now, they're talking about the brain, and they're talking about, you know, like Facebook, we're addicted to dopamine and these sorts of things. And so, but she was telling me that the hormones are actually something that need to be looked at even more, and they're not being talked about. And it's not something that's just a concern for women, because I think a lot of times people think, oh, hormones, it's something, aren't women the one dealing with those cycles, it's not the guys, you know, we're fine, you know, I'm cool with you, don't worry about me. But it's actually something that all of us should be thinking about and being aware of. And so it seemed an amazing opportunity for us to be empowered with this knowledge, because I'll be honest, I know very little about what she's about to talk about. And I'm excited to enjoy this talk. So we're very happy to welcome Dr. Ray St. Arnault, telling us how to have healthy hormones. Please give a huge round of applause.
Awesome. So thank you, everybody. It's a real pleasure to be here. And such an honor to be speaking amongst such amazing speakers with such wealth of knowledge in the health and wellness industry. So today I'm here to talk to you about hormones, and I think we hear a lot about hormones, but there's also a lot of myths out there about hormones. And hopefully my presentation today will just, you know, enlighten all of us a little bit about the complex nature of hormones. So what are hormones? Hormones are our communication system. It's they're what actually tell our body things like what time to get out of bed in the morning, to ovulate, to, you know, be tired at a certain time of day, to be awake during a certain time of day, to have sexual interest in somebody. All of these things hormones do for us, and they actually are such an integral part of our life, our mood, our energy, that we sometimes forget that even sometimes our personalities are affected by hormones, and we can go years and years and years with hormonal imbalance and actually think that that is who we are. We're a grump, or we have anxiety, or we have low energy, or whatever. And so much of this, of our entire identities, can actually be wrapped around our hormones. So I'm just going to talk a little bit about some of the hormones out there. So this is just a very short list. There are actually more hormones that are on this slide, and the ones I'm going to talk about are the ones that are underlined. So we have cortisol, thyroid hormone, estrogen, progesterone, and testosterone. And I underlined vitamin D, not because I'm going to talk about it, but because vitamin D is not a vitamin, it's a hormone. And not a lot of people know that, so it's just a little tidbit for today. So hormone interactions are complex. You're going to see a lot of writing on these slides. I don't want you to pay too much attention to them. It's there for your reference if you want to look at it later. But I just want to illustrate the complexity of hormones. These are just the sex and steroid hormones. These are the hormones that come from cholesterol only. And a lot of these interactions and these conversions actually happen in different organs of the body, and many of them actually happen in the liver, which is why I'm going to talk a little bit about why the liver and gut health is so important to hormonal health. Up here, we have cholesterol, and as you come down over here, we have hormones like cortisol, and there's progesterone, and on this side, we have the sex hormones, testosterone, and then estrogen down here. How do we test hormones? As a naturopathic doctor, I'm interested in testing for hormones. So you can talk a lot about hormones and maybe what your hormones are doing, and actually what the symptoms somebody are having are actually sometimes more valuable than what's on the test. However, when you go into treating hormone imbalances, you do want to test. And so these are the different ways that we test. And the first one is the way that is commonly tested in your standard medical practice or your standard medical office. And then as naturopaths, we also like to test saliva and urine, so you get a lot more information from those other types of tests. The other thing I want to mention is that hormones interact with each other. So when somebody has a thyroid problem, it often relates to another hormone gland somewhere else in the body, most often to the adrenal glands, which is the gland that produces cortisol, which is our stress hormone. And the gonads, of course, our testes and the ovaries, they produce things like testosterone, estrogen, progesterone. So cortisol is the first hormone I want to talk about because cortisol is the stress hormone. It's made in the adrenals. It regulates blood sugar and wakefulness, and it has a diurnal pattern. So by diurnal pattern, I mean it fluctuates throughout the day. When you have imbalance in cortisol, you may be the type of person that might feel groggy in the morning, right? So you're just not a morning person. So again, getting back to personality, are you just not a morning person, or do you have a hormonal imbalance? Are you a night owl? Do you get a surge of energy around 11 o'clock at night or after dinner? Do you describe yourself as somebody who's tired but wired? Do you have blood sugar crashes? Do you have difficulty losing weight around the middle? Do you have allergies? Have you noticed that wounds don't heal properly? The integrity of your connective tissue is not as good, or you actually get dark patches where wounds heal. Are you short-tempered? Do you have low blood pressure? Do you crave salt? Do you have any kind of other hormonal imbalances like PMS, hot flashes, and for men and women, low libido? This is because cortisol affects every other hormone in the body. When you have a cortisol imbalance, all the other hormones are affected. So cortisol actually varies throughout the day. So naturally, so the dotted lines, those naturally we're supposed to fall within there. So in the morning, you're supposed to have a nice big peak. And this is where people, speaking of coffee earlier, this is where people like to drink their coffee if their cortisol is lying on the purple line. So if your cortisol is on the purple line, that means you have adrenal exhaustion. You're not producing enough cortisol to get you up in the morning and then throughout the day. So again, here, cortisol spiking in the day and going down in the evening. So if you have like a reversed cortisol pattern, that means you're actually feeling awake at night and you're feeling groggy in the morning. So Stress is what actually regulates your cortisol, right? So it's what actually changes the way your cortisol fluctuates during the day. So how do we treat cortisol imbalances? Relax, develop a routine for yourself, predictability, right? Love, connection, breath work, breathing properly. Go to bed earlier, shut off your electronics after 9 p.m. One of the things that spikes cortisol is light. Just light, simple light, will actually cause cortisol to spike. So if you actually have a computer screen flashing in your face at about 9 o'clock at night, what does your body think? Yay, the sun has risen and we're gonna get up. So you want to shut your electronics off at night. You want to eat regular meals to keep your blood sugar constant. And one of the reasons for that is because when you don't eat properly, that's a physiological stress. So your body actually dumps out the cortisol, dumps out the adrenaline in order to actually spike your blood sugar. You can do natural therapies like B vitamins and vitamin C. So the reason I started off with cortisol is because this is the root of why stress causes so many problems in our life. So I'm trying to make the connection here between physiology and physical illness, because we always talk about this mind-body connection and why this is happening. Well, if you have chronic stress in your life, and again, this is getting into complicated slides, but maybe some of the science nerds out there will like this, is you have, estrogen down here and testosterone and DHA. So these are all anabolic hormones. These build us up, they build vitality, they allow us to reproduce, they make us feel good. And we have up here progesterone and down here cortisol. So they all come from the same precursor molecule. When we're stressed, this red line is showing how we shunt all of the precursor hormones into cortisol in order to stay stressed. So if you're constantly spiking your cortisol, you're actually depleting your other hormones. And PMS is actually caused, or one of the causes is a low progesterone to estrogen ratio. So the first thing that gets depleted is progesterone, and progesterone is the calming hormone. So another thing, menopause. So when that goes on for a long time, we actually start depleting our estrogen as well, because after menopause, it's the adrenal glands that take over the role of producing the female hormones. So when you have a history of stress, you probably will actually have worse menopausal symptoms. Let's just skip through. So the thyroid. So let's talk about the thyroid gland. So signs of low thyroid. Maybe some of you have these, I don't know. But one of the first things that I've seen manifest in people with low thyroid is being cold all the time, or cold hands and feet. So we think of somebody with thyroid problems as people with weight problems. But you could also just be cold and still have thyroid problems. Depression, dry skin, constipation, thinning of hair, etc. So I just want to show these photos to you guys because going back to identity and like what we identify ourselves as and what we look like. And all of these photos are photos of people before and after thyroid hormone treatment. So if you actually look closely, you know these people, right? You've seen these people. Maybe you are these people. And so look at the difference in how these people look. Just look after they've been treated for thyroid problems. Isn't that amazing? Yeah. So Thyroid Help. How do we help the thyroid gland? We fix the adrenals, right? We go back to gut health. We detox. We reduce inflammation. Seaweed. So one of the things that we're quite low on, our diets are quite low in North America, is iodine, right? So we getting to eating more food from the ocean. And let's talk about estrogen, because we all know about estrogen, right? Estrogen, it's about finding the right balance. Again, stress and estrogen. There we've got the cortisol, we've got the estrogen down here. All the precursor molecules from estrogen are going into making cortisol. So once we get into menopause, we have states of low estrogen, right? And some signs of low estrogen, which actually some people don't actually attribute to being associated with estrogen, are low libido is one thing. Everybody thinks libido is all about testosterone. So for women, it's often related to low estrogen. Brain fog, fatigue if it lasts all day long, skin, integrity of the skin, if you have chronic urinary tract infections, poor healing in general. And this one's a really big one here, muscle pain. And now they're finding that actually low estrogen is a risk factor for heart disease in women. Hot flashes. Again, not as much related to estrogen as to stress. So they're actually finding that hot flashes are more to do with spikes of adrenaline than they are with estrogen. And again, adrenal fatigue. So again, eliminating caffeine, sugar, and alcohol, and supporting the liver. High estrogen. So high estrogen is often a problem when we're in younger women, so before menopause. High estrogen symptoms are PMS, irritability, anxiety, depression, insomnia, any kind of menstrual problem, so menstrual pain, clotting, heavy flow, irregularity. These are things that people consider normal, right? We actually, as a culture, as a society, we think that PMS and menstrual problems are actually normal things that women just have to, quote, endure. And it's actually not true. You can actually have a completely, like easy menstruating experience. Endometriosis, fibroids, PCOS, breast tenderness, headaches. So women who tend to be prone to headaches also tend to have estrogen imbalances. And that's just going back to that slide. So things to help with your estrogen metabolism. Goji berries, it helps with proper estrogen metabolism. Eating foods from the cabbage family. So that's kale, collards, kohlrabi, Brussels sprouts, collards. Did I say collards? Isoflavones from soy, kudzu, and actually flax as well. And then also improving bowel and liver function. So hormones get detoxified through the liver and through the gut. So we want to make sure that you have enough fiber and vegetables and omega-3s and other things to help your gut and liver function. So that was women, and so now what about the men? Men don't get hormone problems, right? Of course not. So what is IMS? Okay, so this is a new syndrome that's just been sort of diagnosed, and it's becoming more and more prevalent every day. It's called Irritable Male Syndrome. You may be experiencing this. Withdrawal, so as you age, withdrawal, sadness, anxiety, frustration. Do you feel more stressed, inability to cope? Mood swings, anger, tenseness, sarcasm, hostility. Do you feel less loving toward your partner? Impatience, argumentative, demanding. So this happens actually, this is what we call andropause. And so we've heard a lot about menopause. How many of you heard the word andropause before? Yeah? So it's actually real. This isn't a joke. So with women, we have this event that happens. It's like a non-event, actually. It's the end of a menstruation, right? Or that we call menopause. But in reality, women's hormones actually slowly decline over a number of years, and then there's this one sort of pinnacle event where you stop menstruating. Well, the same thing happens with men. Men's hormones decline over a period of 15, 20 years as well. But there's not a single event that marks, this end of, youth. But one of the first signs of andropause is this, and this happens quite young. And any amount of this going on in a man is actually a sign of excess estrogen. And in the previous slide, I showed you how the hormones are interacting. Well, there's two ways that your testosterone can be lowered. It can be stolen by cortisol, so you're stressed, or it can be converted to estrogen through that. And so in the fat, there's this little enzyme called aromatase that actually converts testosterone into estrogen. And that's what's happening there. And it just keeps going and keeps going and keeps going. And pretty soon, a guy that could look like that actually looks like this. So it's a 10 to 15 year process. But this is actually happening over a long period of time. So this is another sign of andropause, okay? So again, this is excess estrogen in men. And this is actually what a lot of men think of as normal, It is normal, I guess, if you want to talk about, a lot of men experience it. So what has changed? Do you have belly fat, more belly fat? Do you have man boobs? Do you have decreasing muscle mass or strength? Is your sleep getting poorer? Do you get up to pee at night? Do you have decreasing sexual function? Decreasing sexual interest, fatigue, depression, lower zest for life? All of these are a sign of going through andropause. So the problem is not andropause, it's just like the problem is not menopause, right? We have a slow decline in life up until death, and that's okay, it's normal, okay? But it's the age that it starts. So there's men that are starting to experience this as early as 40 or younger, and that's the problem. The same with menopause. It's happening younger and younger and younger and younger. Why? There's so many toxins out there. Men are stressed. And interestingly, toxins, and a lot of you might already know this, but a lot of the toxins out there are actually estrogen mimickers. They actually mimic estrogen, so it's actually compounding the problem, right? So low testosterone, so it's not just about zest for life, it's not just about being manly, it also puts you at risk for a lot of other things. So they're actually using testosterone or testosterone levels as early markers for diabetes. You're at increased risk for osteoporotic fractures, cardiovascular disease, inflammation, sleep apnea, and anemia, etc. Like lots of problems come with this. So I'm going to skip through these quicker, but these are just other ways that low testosterone can affect you: mood and brain function, sexual function, and physical. And why? So I talked about this, stress. So it's interesting, the speakers that spoke before me, right? Getting your stress under control, because otherwise your little cortisol pathway is stealing your testosterone from you. Diet, again, getting into blood sugar control, right? So insulin and anything that affects insulin and that actually promotes excess fat accumulation is going to create more aromatase in your body. It's going to convert that testosterone into estrogen. Lack of proper physical activity, inflammation and gut health, again, toxic environment, which we talked about, xenoestrogens. So what can you do right now? You can lower your glycemic load. That means lower your blood sugar, lower the sugar intake, tackle the belly fat and detoxify, lower your stress, increase your sleep, and address your gut health. So the liver-gut hormone connection. So again, going back to this, half these interactions happen in the liver. So support your liver, okay? Another just general tips for everybody, so hormone tips for everybody. Eat a big breakfast. So that's one of the biggest problems. It's the first thing I actually prescribe to patients when they come in. I go through what their diet is, and nobody eats breakfast. Well, this is what is telling your body to get up in the morning. This is what's giving you energy throughout the day. This is going to keep your blood sugar stable throughout the day, and it affects your hormones. It affects your hormones. So this is the first part in making sure your body isn't stressed out, so that all your other hormones are functioning properly. Ditch the cereal and sugar for breakfast. So eat more protein and eat more whole foods for breakfast. So cereal and sugar is like it's a bunch of milk, hormone milk, and a bunch of sugar. That's exactly what it is. And so ditch the cereal and sugar. Go full fat. So I see a lot of people avoiding fat. And actually, I don't want to get into this, but that was all a sham. So all the research into low fat was a complete sham. And so we have to actually forget that as a society. It's not fat, it's about refined carbohydrates and sugar. That's what makes you fat. And fat is actually a very, very important part of a healthy diet, as long as you're getting the right kinds of fats. Balanced and clean protein. So if you're gonna eat meat, go organic. Vegetables, increase your vegetables, increase your fiber, and increase your low glycemic fruit. So a lot of people eat a lot of fruit because they think it's good for them. And I think fruit is good for you. But the problem with fruit is that the way we've bred fruit is that fruit is becoming more and more high in sugar and lower in fiber and lower in nutrients. And so basically a lot of the fruit out there is actually just packaged sugar. Vegetables again. And the other thing I want to mention, and this is because I'm probably in a room full of fairly health conscious people right now, and it's the salt kidney vitamin D story. So as we get into winter, our kidneys actually need a signal that it's winter time, and that's the potassium goes down as we eat less fresh fruit and vegetables, and the salt intake goes up. So there's a slightly higher salt ratio, and that actually signals to the kidneys to produce vitamin D so that you survive the winter. So there's actually such thing as like too healthy eating. And that's people who are way too low salt, and then they basically are eating summertime food all winter, and they're going to be deficient in vitamin D, in their natural vitamin D. So again, I'm not saying pile salt onto everything, but if you are in that category of people who is really strictly avoiding salt, and you're eating things that aren't seasonal, you may be at risk for lowering your vitamin D. And then obviously your calcium. Caveman exercise. So this is actually hormone friendly exercise. So there's a lot of research that's been done into this. And if you do interval training or short bursts of intense activity, right? So you're getting your heart rate up and down, up and down. That actually promotes healthy hormone production. So you don't just do cardio where you're just going all out for an hour. Just as if exercise as if you were out there hunting or whatever. You run for a little bit, you stop, you take a rest, etc. And also exercise in the morning. So a lot of people go exercise at night. Well, one thing that spikes cortisol really well, exercise. When do you want to spike cortisol? In the morning, right? If you go exercise at 9 o'clock at night, you're telling your body, wake up, right? So that was my conclusion to the generalized hormone talk, and I just wanted to leave you guys with a little bit of holiday hormone tips, because we're going into the Christmas season. I think one of the points of this wellness show being right now is to how to get through Christmas and be able to enjoy yourself and feel good. So support your liver. So yeah, the alcohol consumption may increase over the next month. I encourage you guys to, if you are going to be having turkey, buy a free-range turkey, buy an organic turkey. Lower the toxins that you're getting in your body and support your liver so that your hormones aren't doing so badly. Also, support your liver. So this is where a health professional or a naturopathic doctor, or in this day and age, Google can help you out. You can actually support your liver through some really amazing supplements and herbs. And one of those herbs is actually milk thistle. I don't know if you guys have heard of that one, but it's a very, very strong, potent liver protective herb. It's actually a seed, and you can eat that. And it's actually shown to prevent liver damage, even if you are drinking alcohol. Reduce system stress. So stop worrying about presents, right? Wind down with the season and the sun. So get back into looking at what the sun is doing and mimic what the sun is doing. So wind down, sit by a fire, have a hot cocoa, visit with family, chill out, That's what winter's all about. It's about going inward and calming down, right? Support your adrenal glands. So throughout the winter, you can, if you want to, you can actually support your adrenal glands to help support your stress response with vitamin C, B vitamin, and other herbs that I can tell you about anytime. Support your digestion, so include adequate fiber from veggies and seeds. So rather than eliminate, maybe add to your diet. Winterize your diet. So what are things that grow in winter really well? Squash, kales, like the darker leafy greens. Include more of that stuff in your diet. Nice stews. You know, it's the one time of year where cooked things are actually really good for you, is in the winter time. Avoid fasting or intense detox diets. These really stress out your system. And also, if you really need to, for that really heavy Christmas meal, you can actually get digestive aids and, you know, digestive enzymes. That's it.